you have to take it with not a grain of salt, but a chunk of salt. It is anxiety producing. In medicine and science, we like to know history on things, just like in life. We don't have a lot of history on this. Sometimes from my perspective, medically, there's a disconnect between actions and words.
Right.
And I think that both are important, but I look at this really as a doctor and as a scientist and as a physician, which is no different, even though there are potentially millions of people affected by this. I look at it like an individual patient. We don't have a good grasp right now on the numbers, okay? When we hear 80,000 cases worldwide, the 80,000 to me is less interesting than how many people have been exposed, how many people infected, how many people are tested.
There's no way to know half of that.
That's right.
Yeah.
So a number in isolation, you have to take it with not a grain of salt, but a chunk of salt, because you can't interpret anything in isolation. Right now, according to the CDC, this is a highly transmissible virus with a low mortality or fatality rate. And that's really important right now. The masks that's been one of the biggest parts, trending misinformation myth in this story. Surgical masks, like you just referenced, Anna, are used in healthcare settings they're put on sick people so that if you're spewing droplets, coughing, sneezing, vomiting, sorry if you're drinking or eating your breakfast, that is literally blocked no differently than if I put this up and block it, okay? They are not to protect the healthy from something coming in. The influenza virus particle, the coronavirus particle are so small, they go right through those. And by the way, any mask is single use only.
Yeah.
It gets wet, it's done.
Yeah.
Okay, so if you get a fever, Whoopi, and you're sitting at home and you call your doctor, your healthcare provider, they're not going to say, oh my gosh, let's test you for coronavirus. Right now, and the CDC just changed their screening guidelines for some patients. If you are hospitalized, if you have a fever and symptoms of pneumonia, which you know well, and you have recently been in the last 2 weeks in China, Japan, South Korea, Italy, or Iran, you are a candidate for testing for coronavirus. If you're very, very sick on a ventilator and they can't explain what you have, they'll test you for coronavirus. If you come in with a fever right now and a cough, they're going to test you for influenza, and that's the appropriate test to do. When the Chinese sequenced this virus, released that DNA fingerprint to the world early in January, every country was able to start developing a vaccine. So here in Bethesda at the NIH, they have a vaccine that was just delivered to them in the last week. They are going to go into phase 1 clinical trials, which takes 3 months, probably in April. And then phase 2, if they demonstrate safety in phase 1, will take 6 months. The fastest we could see this vaccine available to you or myself is about 12 to 18 months.